introduction. So my name, welcome. My name is Brittany Woodard, and welcome to this sort of introduction to the upcoming course in Ayurvedic pathology. I'm really happy to be here to host today's class and answer any questions that you guys might have. But first, I want to introduce you to KP Khalsa. So there he KP is an Ayurvedic doctor, certified dietitian nutritionist, and a registered herbalist. He has over 45 years of experience working in holistic medicine. He's the president emeritus. He was the president of the American Herbalist Guild, and he was the director of the National Ayurvedic Medical Association. And yes, he is an amazing teacher. He's been my teacher before, and I have to say he's my absolute favorite, simply because he does such an amazing job at making Ayurveda easy to understand, which is wonderful. So welcome, KP.
Hi, Brittany. Hi, everybody. Looking forward to our little talk today. So I'll make have a few remarks about just sort of what this course is all about, why it's important, how we can dive into it like that, and we can certainly have some Q&A. Brittany, are you ready for me to just start talking?
Yep, all ready.
Okay. And I was looking to share my screen, which was disabled a moment ago.
I don't know how to make it enable it for you, so I'm just going to make you the host.
Okay.
Okay. We're recording. Cool. All right, you should be good.
Something happened. There we go. That looks good. That's not. I see what happened. Okay. Just a technical moment. Making progress. That's what we want. Okay, so in this format, I can't see all of you at the same time. So gestures and holding things up and like that are not going to work, but you could certainly speak up. Let me see here if I can make one adjustment. That will be good. Yes, okay. So now I don't have the chat open, but I do have the participants window open. So if you raise your hand in the participants window, I can see you and we can chat by microphone. All right. So Ayurvedic pathology. Well, this is where the rubber meets the road. And I know that many of you have been studying Ayurveda for a while and you've learned about a lot of technical stuff. And now the question is, great, but how do we actually cure disease with Ayurveda? And that's what this is all about. So pathologies are diseases. We're going to talk about them, of course, from the Ayurvedic perspective. Not every disease is viewed in Ayurveda the same way it is in terms of conventional medicine. So there'll be some different names, some different concepts of what a disease is. But the treatment protocols will all be based on Ayurvedic knowledge that you have. Dosha, Dhatu, Mala, etc. So we're going to be learning how to do that. This is a 3-term sequence, one entire academic year, and we're going to dive deep. Hopefully we can make it very understandable. I'm on my 50th year now. I just passed 50 years of studying, practicing, and teaching Ayurveda. And my mission this whole time is to make it understandable to the Western mind. So I learned all of this in internship style or teacher student style. There were no Ayurveda schools when I started all this, and I had to go through the sort of stream of consciousness learning style that Indian teachers often have. But gradually over the decades, I would ask my teacher something like, when are we going to get to this? And he'd say, when you're a little more mature and you can handle it. And I'd say, but I'm 50 years old. How much more mature, I'm going to get? But my job has been to sift through all this and put it together in an academic way so that we can teach it, Ayurveda 101 A to Z. So we're diving into pathology. I'm going to show you some slides that have some text on them. The purpose is not for you to learn from this text or to even be able to read all the text, but just get a flavor of what we're going to be doing in this class. So pathology, you will discover, is very systemic and or systematic. And you're going to be able to use all the things that you've learned so far about basic principles in Ayurveda and apply them now to diseases. So the structure of disease, the ability to analyze the extent of the pathogenesis, in other words, the progress of the disease, and the causative factors. What created the problem? What can we do about that? And we're going to go way beyond things like, eating vegetables and going to bed on time. Those are important things, but we're going to dive into specific remedies. And all of this dovetails with your classes on herbalism, nutrition, diet, lifestyle, all of that. The thing about Ayurveda is that it's difficult to teach in a linear way. It's not like learning mathematics where you start in first grade with your addition tables and eventually you're learning calculus, and you have to do it in a linear way. Ayurveda is more like planting a garden where in order to understand any aspect, you need to know all the other aspects. So it's an upward spiral, whereas you pick up more about one thing or another, you apply it to other things and you dig deeper and you're creating this whole understanding, but it's all very systematic. So it's not, there's a saying in Ayurveda that where there's mystery, there's no mastery. Where there's mastery, there's no mystery. It's not supposed to be mysterious and etheric. It's very straightforward. So if you look at the texts, yes, they used different vocabulary. Yes, they had a different worldview, but they just marched right through all of the principles of Ayurveda and put it all together to help people get well, which is the object here. So they were thinking that way 3,000 years ago, and it still applies today. So then how are we going to develop appropriate solutions for a pathway forward to maintain and regain health? Your clients all come to you because they have some kind of a problem. They're having a migraine every week, they're miserable, and they want to know what to do about it. And so we have very general Ayurvedic ideas, like keep a regular schedule, eat healthy food. But we also have targeted kinds of things that can work on those pathologies. And this is the time now that we're going to dive into those things. So we're going to talk about the study of human anatomy, Sharir Rachana. And we won't overwhelm you with Sanskrit in this course. And I know that's a challenge for a lot of people. So it's not about memorizing a bunch of Ayurvedic factoids or memorizing a bunch of Sanskrit vocabulary. It's about understanding the concepts and these Sanskrit words as you hear them over time, over your career. Gradually, you'll remember the ones that you use. We're also going to be talking about Kriya Sharir. Sharir means body, Kriya means an action. So the study of human physiology. These two things go together to create Ayurveda. And in Ayurveda, anatomy is physiology. It's energy science. And so we want to know where the energies are going and what they're doing at any given time. And that regulates the physiology. So this 3-term course, we're going to be using herbs and then other Ayurvedic medicines that you've learned about, nutrition and body work and such like that, for specific diseases. And of course, it's going to be from the Ayurvedic perspective. So Dhatu, Upadhatu, Mala, Shrotas, and then Vidya, the actual disease itself, anywhere along the line, from the beginnings of these chronic diseases when people are 10 years old to treating them at 60 years later after they've manifested and become disabling. So 3-term course, Pathology 1 is the general structure of disease, and we're going to cover Nidan, which is the premonitory symptoms. In other words, what happens before people start to feel like they're sick, and Samprapti, which in Sanskrit means the birth of pain. Pretty good description for what this is all about, but disease development. So we can anticipate diseases happening decades before they happen and stop them. So when that 10-year-old is starting to feel constipation and kind of vague anxiety, gas, we know that that's going to eventually become osteoarthritis 60 years later, and we want to treat it then. So we'll talk about all that. Deeper understanding of these causative factors and be getting familiar with the Ayurvedic pathogenesis model, which is Samprapti. So the qualities of the different stages of this whole disease development and all that. We're going to talk about the digestive tract, the lung, and the cardiovascular system specifically, and go in diseases of those systems in that first term. So this is all about Vikruti, or the current energy balance in your body. You've all studied constitution, prakriti, and you know the effect of that. Now we're going to talk about not only the blueprint of what is going on in the body from a prakriti point of view, but what has happened to you or that you've done to yourself since conception all the way up till now equals the energy balance that you have now. In other words, the imbalances from your prakriti or disease, the treatment of disease. So we'll talk about things like your current energy, how things changed from your prakriti, specific diseases like asthma or high blood pressure, and dig into these from the Ayurvedic perspective, dosha, dhatu, agni, the things you've learned. So the rubber is finally going to hit the road after all your study with these things. So we know that dosha imbalance is disease. You've all learned about that, and it's due to a cause or etiology where the doshas go out of balance, and that can be the wrong diet, wrong lifestyle, all the things you've talked about. So we know that when we get rid of these internal imbalances, the diseases go away. It works so miraculously. Some of you in classes, I've shared my story a little bit, but I was diagnosed at age 10 with a terminal illness. So nobody lives past 40 with the illness that I had. It was a degenerative illness of my bone structure. And I'm well past 40 now. And if you look at my x-rays, bones look perfectly healthy. The whole thing was able to be reversed through these kinds of natural healing techniques. And the first time I ever got a taste of any of that was in a yoga class. Did an asana that I was out of pain for 15 minutes, which I hadn't been out of pain for any minute of any waking day for 8 years before that. So we're going to dive into the doshas and talk about where physiology becomes pathology. Two types of dosha imbalances, aggravation or excess, and then kshaya, depletion or deficiency. So so far you've talked mainly about excess of the doshas, and the doshas are all in balance with each other. They're integrated, so when one is high, the other two are low. So we're going to talk specifically about how to deal with that whole situation, bring them back into balance. So we know that these imbalances can occur in one location in the body or the whole body. So heart palpitations, that's just happening in your heart. Thinness is a Vata situation in your whole body. So we're going to kind of peel that onion about what to do doshically for things that are not affecting the entire body. So far, most of you have learned about dealing generically with whole body dosha issues, but most people have more than one dosha that's gone someplace in their body and set up shop, and you can have vata in your feet and pitta in your chest, whatever. And so we have to learn about how to send remedies to that spot. We've been talking about that. There was a lot of questions in classes about well, what do we do with this or that thing? And a person has a pitta vata imbalance. If we treat vata, it makes pitta worse, etc. Now's the time to begin to learn that. So all these things are connected, and we know that. This is just a description of that connection of those things. We know that doshas increase by things that have the same quality. So you have high pitta and you go out in the sun, get cooked, pitta illnesses increase. So we know that, for example, congestion gets worse with ice cold water or ice cream. You've talked around these things, but now we're going to put them specifically together and figure out how to know what happened when and how the disease developed and where we can intervene now, and the difference between pacifying symptoms and treating the whole body, including detoxification. So by comparison, congestion gets better with warm water and warm light broth or soup. We know that. So we'll talk about the imbalances in each dhatu. You've learned about them theoretically. Now the question is, how do they apply in actual pathology? So we're going to learn to classify diseases based on dosha, dhatu, and the specific organ. Remember that each dhatu is a tissue type. each organ is a functional unit that does a specific thing. So your bladder is formed mainly out of mamsa dhatu. It's a bunch of muscle, but in that muscle are capillaries, which are rasa and rakta, fat, which is mamsa, etc. And so we'll make that distinction clearly and dive into that whole thing. So Nidan is the etiology or the causative factors. That's also called Hetu. You might have heard of that. So we're going to look at how to know when disease is on its way. The Purvarupa, the prodromal signs. Body aches before the flu is a one having to do with an acute situation. Mild angina is a sign that the heart isn't getting the blood and oxygen that it needs, and we need to investigate why. So we'll go all the way up through the manifestation, how to do a therapeutic trial with Ayurvedic methods, and then pathogenesis or Samprapti. So we'll look at all these kinds of things, the effect, the cause, the principle, how the cause manifested as an effect. We know that Vata can cause, Ayurveda says 80 types of diseases, but that's 80 disease categories that Vata can create. So the question is, how did it get from a little bit of gas from eating too much raw food to overwhelming anxiety or osteoporosis? We'll follow that whole trail. So the cause, Nidan. So the causes can be specific for a dosha, for a disease. So Ayurveda does name diseases only for convenience. So we might have two people with congestive heart failure. We're going to treat them differently because they're a different age, different gender, different ethnicity, a different health history, all of that. So we'll figure out how to treat people individually for diseases based on dosha and whatever. Okay, we looked at this. So this is Samprapti. This is the Ayurvedic model for disease progression, 6 stages. And we'll talk about how disease develops. Most often it accumulates in the native dosha area, so the Vata in the large intestine, Pitta in the small intestine, Kapha in the stomach, and begins to create mild transient symptoms. And then as it gets aggravated, it overflows into some other place in the body. It finds a place that it would like to set up shop somewhere else. And now instead of just having inflammation in your small intestine, you have inflammation in your elbow. And then it continues in this manner. So we'll dive into this whole model and understand it. We have 3 terms to dive into it. It's very systematic, and I think you'll find it easy to understand, although new and some different terms and different concepts. So here's the Samprapti as the disease develops. The roots of disease goes into circulation, relocates, settles somewhere else, becomes established as a disease, and then causes permanent damage and system-wide problems, disability, and issues. So you might wake up, you might have, when you were an adolescent, had heartburn. Then you woke up at age 35 with a sausage digit, which is a finger that's just exquisitely, extremely, unbelievably painful, swollen up to 3 times its normal size, red, and you can't. The weight of the sheet on your finger is just unbearable. So of course you go right to the emergency room. They see 3 of these a day. They know exactly what's going to happen. It's rheumatoid arthritis or lupus starting, and then 20 years later, you have inflamed, deformed joints all over your body. We want to learn to stop that, unwind it, and treat all of these things. Told you a little bit about my story, that I'm only alive. I'm 27 years past the time when I was told that I would die when I was 10 years old. So I've just had the great opportunity to see so many miracles with these kinds of things, and numerous cases where people were sent home from the hospital to die. Conventional medicine did all it could and said, look, your grandfather is going to die in a day. We'll just take him home, let him die in his own bed, surrounded by his loving family. So that's when we could finally get our hands on Grandpa, and the family says, okay, anything you can do couldn't be any worse. And so we start something. Grandpa doesn't die that day, gets a little better, do something else, and unwind the whole thing. And some of these people are alive 10, 20 years later. Just miracles that we can accomplish. This idea of Samprapti and disease development gives us an understanding, a map for how diseases develop, and then how we can unwind them back down. Truly amazing. So let me just show you the development of one kind of disease. This is anxiety. So anxiety that's become overwhelming or disabling for someone. So in the accumulation phase, initially, it's a panavayu, affects the rasa dhatu. It takes place in the Parishavashrotas, or the large intestine, and we can use laxatives, demulcents, and carminative herbs and anti-vata treatments. This is when a person is 10 years old, and cause it from progressing any further. Aggravation, similar thing, it's getting worse. Now they have constipation, they have gas, then they begin to have dryness, it's going somewhere else. Then cold starts to happen. So now we have cold, dry, constipation, and dryness happening in the Vata system. We're now using warming circulatory aids, and then it goes to the Manavahashrotas, the mind, through Pran and Vyan Vayu. And now we have to use sedatives and specific anti-Vata kinds of remedies. So we know where it came from, we know where it's going. It's just a map to the whole thing. It's amazingly consistent how these things happen. You're talking to a 70-year-old with anxiety so bad they can't sleep, and you ask them, do you have chronic gas? Oh yeah. When did it start? 10 years old. What did you do about it? I just tolerated it. And now, it's overwhelming, and it's led to anxiety. So Samprapti, we'll dive deeply into that. In the second quarter, Pathology 2, we're going to talk about even more targeted approaches to resolving the diseases and management, looking at the disease states from this perspective and figuring out how to use especially rejuvenation therapies. We'll dig into then further tissue types and talk about brain and nerve and bone, muscle, all these things that you see here. So for example, we'll talk about how mamsa dhatu, the muscles, can become sick, and how pathology can be a problem. Understanding that, then, once we know the whole system, we can use appropriate treatments to treat that. Very effective. So we'll talk about, for example, here's mamsa. Could a person have too much mamsa tissue? What causes that? Signs and symptoms, benign growths, weight gain, things like that, hemorrhoids, warts. These are all problems with mamsa dhatu. They seem disconnected. Hemorrhoids, warts, tonsil problems, but they're all part of mamsa. So we can narrow it down, treat mamsa, all these things go away. So symptoms of excess mamsa. Then we'll talk with each of these, doshas, the management of this. Mamsa vruddhi means too much mamsa, too much muscle tissue. So we'll talk about how to do that using all the skills you already know: herbs, nutrition, lifestyle, etc. So the management of all of this. And we'll just go through each tissue type, bunch of various diseases, give you a roadmap for how to bring people back to health. So just in this example, here's mamsa reduction, kshaya, poor nutrition, chronic degenerative illness, etc. Let's go through these various causes, and we'll help you put together checklists that you can use with your clients and figure out how to ask these questions and do all of your assessment. Signs of mamsa kshaya. So we'll talk about food, targeted specific food therapies, dietary issues, of course, herbal medicine, body work, psychotherapy, lifestyle issues. And rather than just learning about them in general like you have, we're going to be talking about specific targeted kinds of things to treat diseases. In the third session, third quarter, we're going to be talking about more aspects of each Shrotas, Dhatu, and organ. And now we're going to address pathology specifically associated with the organs. So kidney issues, liver issues, eye issues, reproductive, endocrine, immune, all of that, one after another. And we'll cover a wide variety of diseases over the course of this. This is where it all really starts to come together and make sense. And of course, that's what you're there for, is to help people resolve these things. People don't come into you and say, I'm doing great, I have a great lifestyle, great diet, and I'm feeling fantastic, and I just want to keep feeling fantastic. In 50 years, 2 people have done that in my practice, 2 out of thousands. They don't come to you until they're busted. And then they want to feel better quickly. And of course, that's our challenge, is how do we do overall lifestyle improvement while still targeting these specific diseases, helping them unwind this. So we can do things from both directions. We can do rejuvenative kinds of things and teach them how to eat and sleep and all that. And we can target their specific diseases so they kind of meet in the middle. And then they have techniques to prevent getting sick again in the future. We want people to be robust, healthy, pain-free, have great energy, be sexually functional, have a strong immune system as long as they want. 90 years, 100 years, 110 years. Eventually, the Grim Reaper is going to win, and it's a contest the whole time. But most people, the way that we live in modern culture, according to Ayurveda, could live another 10 or 20 years past what they're living now if with some very simple kinds of ideas. And so we'll help people maintain those things. Now, increasingly, we're seeing just an avalanche of people with chronic long-term diseases. Our culture has gotten very good at keeping people alive, but it hasn't gotten very good at keeping people from being miserable. So we don't die of epidemics of cholera anymore, or your horse steps on your foot and it gets infected, or you cut your leg chopping wood. People don't die of a heart attack, their first heart attack anymore. Used to be you had one heart attack, that was it. Now you can have multiple heart attacks. Hopefully people wake up after the first one, but of course, where we are. So people come to you and say, I have these problems, I don't feel good, and we can work from both directions to help them heal. So we need to know about the pathology. So we're going to study specific diseases. Vyadi is disease, so Vata diseases, for example. Here are what the classics tell us are the numbers of Vyadi diseases by dosha. Now, this doesn't mean specific individual diseases, it means categories. So, Vata has constricted lungs, for example, as a category of one of the 80. Well, that could be asthma, bronchitis, COPD, a bunch of different things from our modern perspective, but 80, 60, and 40. So we know Vata is the culprit, and we'll talk a lot about that. So how does Vata get out of balance? When any Dhatu gets depleted, it creates empty spaces. We know that Vata wants to go into empty spaces. Your bones are empty on the inside. Any time that Vata has a chance to go somewhere, it likes to fill empty spaces. So places, when your organs shrink over time, for example, they're not taking up their whole abode, their whole kshaya in your body. Everybody's brain shrinks a little bit. Again, you're not going to get out of this alive. There's going to be, regardless of how perfectly you live, there's going to be some degeneration because everybody dies. But it doesn't need to be pathological and miserable. We want you playing full blast volleyball when you're 95, like a guy I recently hosted did, Ayurvedic doctor. And then the other thing that happens with Vata is that the normal flow is blocked. It's blocked, enveloped, trapped somehow, and Vata doesn't like that. And so it goes somewhere else. So Vata can cause either catabolism, destruction of tissue, or it can cause anabolic growths of things in places where they shouldn't be. And now you just have chaos. So we're going to learn to control Vata dosha, which is the big culprit here, of course. So this is the Vata diet that causes problems: excessive fasting, physical activity that you're not healthy enough for, not enough sleep, staying up late, COVID, anxiety, excessive sexual activity. All these things are the premonitory symptoms for Vata diseases. So we're going to talk about these and how they fit. Even more, that Ayurveda is all over the suppression of natural urges, and especially passing gas for Vata, which is what we're talking about. So wherever you are, Ayurveda gives you absolute permission to fart to your heart's content. And we saw a politician, a whole big meme just yesterday about how that happened out there in the world of politics. The fart heard around the world, but clearly it was Vata dosha. And based on this particular person's behavior, I think we can conclude that Vata dosha is deranged Anyway, not to get into the politics of it, but suppression of natural urges, especially gas, is a problem for Vata, and Ayurveda is all over that. All right, stress, worry, anxiety, the cold seasons, all these things push Vata further into imbalance, and we'll talk about how to handle it. So these are kinds of symptoms that can happen from those things, and these symptoms develop over decades. And then the person comes to you with, of course, very challenging tridoshic mixed, all assorted stuff happening all at once, and we have to straighten it out. That's what we're spending a year doing, straightening it out. You have a person that comes to you with heart disease, they're 75, it's almost always tridoshic. And from what you know so far, that's just impossible to deal with because, you warm them up, it creates problems with pitta. You cool them down, creates problems with vata. You've got all three doshas in one organ. Now what? We'll help you figure out the map to deal with that. So as vata diseases progress, we see these kinds of symptoms. Uh, Tremors, sensory disturbances, stroke, paralysis, carpal tunnel, all these things. So we'll march right through all these ideas for each of the various diseases, organs, tissues, doshas, get it all straight for you so that you know what to do when. And we'll do it in a way that should be very understandable. I just got an email from a student uh, this morning who said for the first time she understands how Ayurveda works. This is a person who's been living an Ayurvedic lifestyle for at least 10 years. She's an avid yoga practitioner. She's read 20 books on Ayurveda, but she still couldn't figure out how it all worked out. And by taking a class, we straightened it all out. And that's what we're here for, is to make it understandable. So here's how we manage Vata diseases. Oiling and sweating, gentle cleansing, external oiling, using oil in all kinds of different ways. And of course, we'll get into a bunch of specific treatments for these things. So here's just an example of a disease, multiple sclerosis. My specialty in practice is neurology. So I deal with multiple sclerosis. I'm probably one of the two most active natural healing professionals in North America dealing with multiple sclerosis. And we both have an Ayurvedic background. I have countless clients with multiple sclerosis. I just had a client this week who got out of her wheelchair, and I did a 1-month follow-up with her, and she's walking around the neighborhood, and she was in her wheelchair for 10 years. And it just took about 18 months to get to that place. And we used this kind of an idea to get her there. So I deal with epilepsy, autism, migraines, multiple sclerosis, that sort of thing. So I don't think the first case after you graduate from your program at Yoga Veda is going to be a multiple sclerosis. But just to give you an idea that we can handle these more difficult things. So we would call this Vata pushing pitta into the Majja Dhatu. Pitta affects Tarpaka Kapha. You've learned all these things. You know these terms. You're probably still struggling a little bit to figure out how they all work together. That causes the demyelination. We could call it Tejas burning ojas on a more subtle level, causing the demyelination. So multiple sclerosis is an ojas deficiency disease. It's a disease of cold weather. Doesn't occur at the equator. Further you go toward the pole, the more multiple sclerosis there is. Vata disease. So what causes it? Vata provoking diet and lifestyle. So you have that junior high student that's starting to say, you know what, I don't have a bowel movement every day. And when I do, it's hard and uncomfortable. And I have a lot of gas. And, I just don't feel very good with anything that I eat. They don't know how to express it very well usually. And they end up kind of tolerating it. And they're living on cold Starbucks drinks, of course. And then as it gets worse and worse, well, is it going to go the direction of multiple sclerosis, the direction of osteoarthritis, the direction of anxiety and insomnia? Maybe all those directions. It depends on the person. So the Vata provoking diet and lifestyle starts in middle school. These kids know that food is not their friend, and so they stop eating. This is all subconscious. And they resort to eating sugar because it digests very quickly and doesn't give them gas. So these are the kinds of things that are the Nidan for multiple sclerosis. And how does it develop? Well, the Vata and Pitta accumulate, get aggravated, enter the Rasa Dhatu, end up going into the Majja Dhatu, which is the brain and nervous system. Siddhaka Pitta gets aggravated, that aggravates Starpaka Kapha, and now you have all three of the doshas involved in regulating the brain, involved in the nervous system, involved in multiple sclerosis. The mind in Ayurveda is not the brain, but the mind needs the brain to function properly. And so usually the brain, it's in the Majjadhatu, that's the brain. And now the mind can't act properly through the organs of action, and it doesn't get good information from the environment through the indriyas, the sensory experience. And so people have more and more difficulty figuring out what's going on in their life, making proper choices. And, it just gets all scrambled up and progresses and becomes worse and worse. But I know for sure that we can reverse it. So we've been working on this for 50 years, and now we're there. Now we can treat it effectively. And so a very serious disease that's otherwise fatal from a conventional point of view, we can work on treating. But also we'll talk about cold and flu and, just those kinds of things. Anyway, these are the signs and symptoms. And so for a bunch of diseases, we'll go through these things, and we'll get into these brain and nerve diseases in quarter 3. So more and more signs and symptoms of this. So how are we going to manage it? Panchakarma, oily treatments, snan, sweating treatments, enemas, basti, and all these things. We'll talk through all these remedies, some of which you've heard of, some of which you haven't. So now we'll get into much more specific kinds of remedies that target particular kinds of diseases, and we'll talk about pre-made formulas that are available on the marketplace from Ayurvedic perspective, and how you can put together your own mixed herbal programs and dietary kinds of things like that. Anyway, this is just an example of the kind of thing that we're going to work our way through once we've got the basics down in the first couple quarters, including the prognosis. Okay, so finally, all of this has to result in actually doing something. So how do you design the therapeutic protocol? Well, these are the kinds of things we need to know. So you already have the foundation, the basics to go through these kinds of things, and we'll put it all together and say, okay, based on these specific things, what are we going to do as step 1, and how is that going to proceed and finally get to the place where they're no longer symptomatic, they're feeling good, the doshas are in balance, and then how do we use anti-aging rejuvenation therapies, rasayana remedies, to keep them healthy. One of the beautiful things about doing this as long as I have is that I've gotten to see these things work over time, and just I know how well they work, not only in myself. I went to my medical doctor the other day just for annual physical and blood test, and I don't take any prescription medications, and I never have. So I was filling out my form that you do, and it's now on a tablet. And there's the place where you fill in all the medications that you're taking. And I left it blank, and I handed it in. And the nurse at the desk said, you forgot to fill out your medication section. I said, it's because I don't take anything. And they said, in this clinic with several doctors, we have literally 0 67-year-old patients who aren't taking medicine. So, and as it turned out, they thought I was lying. And they said, you can either sign a notarized statement that you're not lying to us, or we're going to test your blood and urine for every known drug. I mean, they were very serious about it. So they said that puts you in the top less than 1% of Americans that are not taking prescription medication at age 67. So at least for all the things I've been able to do, that feels like a victory. And you can help your clients reverse all that and get to some place which, wherever they want to go, you can help working on their various pathologies. So we'll help you put together the therapeutic protocol, and you'll come out of this 3-term series with a bunch of ways to treat various diseases, how to figure out how they started, where they're going, what the development is, what the future looks like, what we can do about it, short term and long term. you will be peeling the onion with learning things about Ayurveda for the rest of your life. If you stay active and continue to practice, I just had a big aha moment last weekend about something from, oh, that's how that works. After, wading in Ayurvedic waters for 50 years, still, I'm having insights into how it works. And, even the folks that wrote our enormous texts said that it was impossible for one person to ever master it all, and that none of them ever mastered it, and we're continuing to learn. So it's going to be a lifelong learning process. And I hope you can stick with Yoga Veda for as far as Yoga Veda wants to take you, all the way through your Ayurvedic education. I think you'll find that this way of doing things is pretty remarkable, and it's going to work very well for you over time. And then you'll be able to look back and see all the kinds of things that you've done, and realize that your clients are living a very different life than they otherwise would have lived, and you've spared them a lot of misery. Okay, so that's what I have to say about that. Let's talk a little bit about what you want to talk about. You can raise your hand. I'll call on you. That'll keep it a little bit more, or not that hand, the electronic hand. No. I'm looking at Amy. She raised her left hand, then her right hand. No, your electronic hand. But you can go ahead and start, Amy, since I can see your hand.
What do you mean by electronic hand? I'm new to Zoom.
Oh, well then, good luck. The robot hand is part of Zoom. My dashboard here looks different than yours, so I don't know how you raise your hand on your side. Who can help us?
So you would hover over where it says participants at the bottom, and then the participants will show up on the right side, and then you can raise hand. There's some buttons. Press yes, press no, go slower, go faster.
We'll let you marinate in that a little bit for a moment.
I see it now. Okay. So like this.
Yeah.
Oh, okay.
Amy, what would you like to say?
I was wondering, what do y'all deal with mental disorders too?
Absolutely.
Because I haven't. I'm just going for 10 days, kind of like. So I was supposed to start yesterday, but I was so busy I didn't have time to do it. But I'm starting today, and I just wondered. I mean, my dream someday is to become a Reiki healer, because I already have some abilities that I've used before I even learned about Reiki. And I also deal with mental, like PTSD, with myself, and other, like, another disorder. But I want to know, I mean, when do you in the class deal with mental disorders? Do you go over that too?
Absolutely. And in fact, Ayurveda would say that all physical disease comes from mental issues. So we would like to be, I think, even more involved with that. We have a tremendous collection of techniques to work with those things, meditation, breathing exercises, whatever. Yeah. Most people in our culture are not yet ready to talk about that. So most people come to us for physical kinds of things, and then maybe advance into those, even though we would like to talk about all of it together. So yeah, Ayurveda is very much mental disease oriented. In fact, that's even more of a core. Brittany, can you tell us what the prereqs are for this series?
For the pathology series, it is to complete our foundation courses, which is Ayurvedic Yoga Therapy Foundations and Ayurvedic Nutrition. So when you first enroll, are you enrolled in the program, Amy?
I came from the Body Owl. You know who that is?
No.
So Amy just joined our sister science program.
Okay.
Yeah, so she just started.
I just started, so I don't know anything about it. So.
Okay, yeah. So this is you have to have some basis in Ayurvedic understanding of the way the whole system works, which is what you would get in what Brittany's talking about, these more foundational kinds of ideas. Yeah. So this course starts in in January, and we need to figure out what Yoga Veda can the administration can help you figure out where you need to start. Some folks, this may not be suitable yet because you have to get in, you have to do some of these things first. Sarah's iPad, your hand is up.
Can you hear me?
Yes.
Oh, well, thanks so much for that lecture. That was really quite informative and probably really hard to cover that much material in such a short period of time, but you did it really well. So thank you very much for that.
Oh, my pleasure. Yeah,
thanks. So I heard at the beginning when they were introducing you and giving your bio, they were saying that you are the past president of NAMA. Did I?
No, I was a director. I was on the board of directors. Yeah.
Okay. So, and you'll be more than qualified to answer my question then. So my question is about the treatment protocols that you spoke of briefly towards the end, including like some panchakarma techniques and some basti treatments and stuff. And I'm just curious what your experience is in North America. I'm calling from Canada, but from the States anyways, what your experience is with being able to provide those treatments or even suggest them legally in the States or in North America. And yeah, if you could sort of shed any insight onto sort of the crossover of where there's perhaps some gray areas still because Ayurveda is not a recognized or an accredited profession. So just curious if you could make some points to that.
Yeah, sure. I know very little about Canadian law, but in the United States, medical practices are regulated by each state individually. So it's very widespread. Generally speaking, natural healing has become more and more a part of people's lives over the last, let's say 20 years. And state governments have had other things to occupy their attention. And in the meantime, all of these professions have grown like mushrooms, all of the alternative medicine professions, of course, Ayurveda, herbalism, nutritional therapy, and a whole lot more. And now it's sort of the horse is out of the barn with these things. So on the street, at the level of actually being in the trenches doing these things, there's nothing really is happening to anybody. You have to be reasonable about how you're going to do it. If you put up a giant billboard saying Sarah's Alternative Cancer Center using Ayurveda, you're going to get a visit from the sheriff or the health department. But generally, if you're just doing it at the level that everybody else is doing it, not much of a problem. Most states have, you mentioned basti, and so that's of course enema, inserting an enema snout into someone. Most states have a law that only certain kinds of regulated practitioners can penetrate the body. The question is, when the legislatures wrote those laws, they never had any idea that something like this was coming along. And what they didn't want was non-licensed doctors doing surgery and giving injections. So is it legal to insert your finger in someone's mouth or to, insert an enema snout into them? You can buy an enema at any drugstore and you can insert it yourself. So where does this fall? Very difficult to know. The professional associations, of which you mentioned NAMA is one of at least 3 professional associations associated with Ayurveda in North America. And generally they take a pretty conservative view just because they don't want people getting in trouble and blaming them. But on the ground, you have to talk to local practitioners, your attorney, and just figure out what's happening in your area. And for the most part, district attorneys, health departments have way more than they can deal with without worrying about whether someone is giving enemas to somebody. Now, there's all kinds of possibilities. In the United States, there is a half a dozen states that are health freedom states, which means that anybody can do anything as long as both parties agree to it. And there's some stipulations there, but California, Minnesota, New Mexico, there's a few of these that have that situation, and that creates much more freedom. But otherwise, as long as you're not, actually literally performing surgery, then there are certainly many Panchakarma centers in the United States. People are doing these things. There are private practice situations where people are practicing these sorts of things. And it's, gray in the law. So you have to decide if you're comfortable participating sort of, right up to the edge of the law and, not going over it. There's probably no specific law in any given state regulating therapeutic vomiting, because people writing these laws 120 years ago had no idea that someone would want to charge money in a clinic for therapeutic vomiting. So it's just not mentioned. And again, the authorities typically have no interest in pestering somebody who's doing these sorts of things. I've been doing this, as I said, for 50 years. And when I first started, things were a lot more, the government was more aggressive about these things. But I haven't ever had any legal trouble the entire time. But on the other hand, I don't make outrageous claims and, expect that those things are going to go unnoticed. There are just so many of us now doing all these kinds of things that we've kind of overwhelmed any objection. So let's say that the district attorney decides to prosecute you for practicing medicine out of a license. You're going to go in front of a jury, 12 people, of which 10 are using alternative medicine practices in their own lives, massage, taking herbs and vitamins, whatever, right? So very difficult kind of case to prove that, oh, you stuck the enema snout in someone's butt and you're a criminal that needs to be punished, when they themselves are having, acupuncture and seeing an herbalist and whatever else. So that's kind of where we are. And I think probably Yoga Veda answers this question 10 times a day. So they probably have a, some more specific insight about their courses, but I think that's a good summary. Any other raise at the moment? We have about 6 minutes. While we wait for other hands, Brittany, anything else you wanted to say about any of this?
I actually thought maybe Casey, our student director, she's on the call. Sorry, I didn't give her an introduction. If she has anything to say about if anybody's, she's better with words than me.
Yes, if anybody has any interest in enrolling in KP's pathology program, I will put my telephone number and the email address. You can reach out to me. My telephone number is also available by WhatsApp for students who are international, and I would be able to answer any questions about KP's program, about our diploma program, our specialization certifications, or even if you just want to enroll in individual classes.
Fantastic.
Thank you, Casey.
All right, so Tanika.
Hi. So I'm in the AYT program right now. I just started. So would this be advisable to take once I'm completely done with that program? Or would you do it concurrently? I guess just recommendations.
The Yoga Veda program is an a la carte program where you take things individually and you build up the pieces that you need to get your certificate. So I'll let Casey talk about what the best sequence would be for you.
Nika, why don't we connect over the phone or email me, so then that way we can talk about your specific program.
Okay, perfect. I'll give you a call soon. Thanks.
Hi, Michelle.
Hi. Hi, KP. I'm wondering what the affiliation is with the Integrative Institute, if there is any, because I was on your website looking for an Ayurvedic program, and I noticed recently that it looks like it's in limbo along with the one at Bastille. So I got your email and started checking this one out. So I'm just kind of, are you the main teacher for this program? Are there other teachers?
So
I'm one of many teachers teaching for Yoga Veda. And, out of respect for Yoga Veda, I'm not going to go into describing a whole bunch of other venues and other, situations. I'm involved in some other teaching in other ways. You can go to my website and just, email us or call us or something if you want to talk about those other things. But let me ask Casey again, so where we are you know, how is it set up at Yoga Veda in terms of other teachers and such?
Michelle, so we do have teachers from all over. KP is definitely our lead instructor. He has the majority of our classes in both our health counselor and our practitioner program. We do also classes at KP's Institute. I actually take classes at both Yoga Veda, but also take classes with KP. Since each program does cover different things to encompass, you know, mostly that is what KP teaches for us at Yoga Veda Institute.
Great, thank you.
I'm not involved. I'm not a founder of Yoga Veda Institute. I'm not an administrator. You know, I'm a teacher. I teach a couple courses each term, usually, and occasionally an elective here or there. And that's my role with Ayurveda. I also have a school of which I am the founder, and it's a school somewhat like Yoga Veda, but we offer a wider variety of different kinds of things, but we don't offer exactly the same sequences of things. And Yoga Veda has a professional training sequence for you in Ayurveda, leading to at least a couple levels of certification that I don't have. And then my school has some things in other alternative healing modalities that Yoga Veda doesn't have. So it's a nice, you know, connection that we make. But I keep referring you to all the Yoga Veda administrators because I just show up and teach like a professor at any other college.
Great.
Okay, we have about 1 minute. Any other, anything from anybody? Last chance. Doesn't look like it. Brittany, did you have anything else you wanted to say to everybody? Your mic is off, Brittany. Your microphone.
Sorry.
There we go.
Just if before you close the meeting, if you could make me the host, because I'm answering some questions in the chat box. But other than that, I just want to thank everybody for taking the time out to come to this class, and thank KP for leading this session. And Casey, thank you for helping me answer questions. Yeah, and I hope to hear from you, whether it's through the email or inside our app or in our program or one of our courses. Thank you.
Okay, pleasure being with all of you today. See you soon. If we don't talk before then, have a great holiday season.